Welcome everybody to Just Upright. My name is Doc Jane Ruder. I'm a doctor of physical therapy and I'm a certified dementia practitioner. If you are new to my channel, thank you for watching. Check the channel out. I have a playlist there, and if you hit the playlist, you can see that there are a group of videos that I have made so far. Like right now, I have more than 40 videos on how to apply as physical therapist here in the US for foreign trained or foreign educated physical therapists. I have a group of videos on how to become an on-call or PRN physical therapist, and also videos on PD documentation, health videos, fun, inspiring videos. So check those ones out. And also to support the channel, check this one out as well. So if you haven't checked it out yet, I have 3 books published and they are available at Amazon.com. You just type Jeanine Ruder and these books will pop out. Okay, so the first one is PT Path to US, a foreign trained physical therapist step-by-step guide to US application. So if you want to have a copy of that. And then practical tips for therapists prior to migrating or starting your US practice, full of words of wisdom before you start your US practice here, and practical tips to improve your posture, balance, and decrease fall risk. The Just Upright book. Okay, so please share this video to all people that you know who will benefit from it, from your to your colleagues, older adults, and so that we can reach as many people as we can and help as much as we can. Thank you so much and stay blessed. All right, so today we're going to talk about home health therapy. Okay, so this can apply for physical therapists, occupational therapists, speech therapy. So this is the home health setting in the therapy practice, in the therapy world. So we're going to talk about the pros and the cons of working in home health therapy. Okay, so if you haven't checked the video that I first made, it is the pros and cons of working in nursing home. Okay, so I will have the link here. You can click it here, and that is the video that I have made previous to this video. Okay, currently right now my business partners with agency in providing excellent care in the home health setting. Okay, so I work both in skilled nursing facility and in home health setting. So I can tell you what are the pros and cons based on my personal experience, but I ask colleagues for their input about the pros and cons, and this is the summary of it. Again, the pros and cons varies greatly depending on where you live. Your location is a very important factor to consider. What state you live in, the community you live in, what company you work for, okay, and their policies and procedures. So the first one advantage of working in a home health setting is flexibility. So you can make your own schedule. So you have a list of your patients, and ideally, so if you have a list of your patients, and then put down their location as well. So it's like a puzzle. Every time I make my schedule, it's like a puzzle. So you always group together, of course, the patients who are near each other, okay? And then sometimes it will work, if it will work with your patient schedule, that you can start from the farthest from your house and going nearer to your house. Okay, sometimes it doesn't work, sometimes it works. So but be sure to be diligent enough to plan your schedule so you are not bouncing back and forth and driving hundreds of miles just because you are not organized with your patients. So you can set your own schedule, but of course you have to call the patient and ask them, because you may make your schedule but the patient is not available that day, or that is too early or too late for them. So you always have to coordinate with your patient when you're making your schedule. But flexibility wise, I have heard some colleagues that when their kids were young, they had a full-time home health therapy work, and it works well for them because they can schedule it around dropping the kids off to school and picking the kids off to school and running errands in between. So that works well for them, instead of having like 9 to 5 job or 8 to 4 job, in a different setting. So flexibility is one of the main advantage of working in home health setting. Okay, so the second advantage of working in a home health setting is that autonomy, or one-on-one approach with patients. So I just grouped this together because they are just related. So autonomy meaning maybe, if, for example, in the past, and you're working in a setting that there's a manager, and the manager is just like breathing on your shoulder and looking at everything you do, and you feel like you're walking on a glass every day because you're being watched and nothing you do is right. It's always based on your experience. It's always based on how you were treated. So some people find it very freeing to work in a home health setting in which you use your personal experience and your professional judgment in making decisions without being dictated to the core on what you should be doing. So that is the meaning of autonomy. Okay, of course, don't be fooled that you should know everything. Okay, even though you are there as a therapist, but if you don't know what to do, you have to consult the other therapists in your company, in your team, for consultation, or other therapists working elsewhere, so that ultimately your goal is for the patient to get better, and it's not about you, it's about the patient. Okay, so the beauty of it all is you're working one-on-one in their own environment where they are comfortable, okay, and they are at home, literally at home. They feel at home, they feel safe, and most patients do well when they are in their familiar environment rather than being placed in a skilled nursing facility. They don't know what's going on. They don't have control of their environment. So the third one that I want to discuss is the advantage of working in a home health is our ability to see the progress of their patient in their own environment, in their own home. We can help them to be as independent and as safe as they can be in their own environment. Okay, most patients will tell you they want to stay in their house for as long as they can. Some patients will tell you they would rather die in their house than be placed in a nursing home. So we are part of that goal. And as therapists, you use your professional judgment. If the patient is safe to stay at home, or if the patient needs more help, what are the help that they need in order for them to be safe and independent in their own environment. And that is very rewarding as therapists when we meet that goal, or we able to help them meet that goal. And of course, use your professional judgment. If the patient is no longer safe because of cognitive memory problem and other safety issues, you talk to the patient or to the family and make necessary recommendation what will be best for the patient. But of course, for those who are still independent but just needs help to be more safe at home, that is very rewarding for a home health therapist. All right, last but not least, working in home health setting, depending on the state where you are working and what company you work for, but in general, there's a decent pay in working in a home health setting compared to other settings such as an outpatient facility. Okay, so we're going to talk about real quick what are the disadvantages of working in home health. Okay, so if you talk to any home health therapist, the first disadvantage that they will name is paperwork, paperwork, paperwork. Okay, especially there's what we call in home health is oasis, start of care oasis, that has more than 150 questions, I think, that needs to be answered and documented. It's like the overall health of the patient assessment. Usually nurses do this, but sometimes if the patient doesn't need a nurse, the physical therapist will be the one who will open up the patient, the case of the patient. So that is the start of care oasis. And on top of the oasis, there are physician order, medication. Medication is a headache to input, because it's not just the name of the medication, it's the dosage and the frequency and what it is for. Okay, so that is one of the major disadvantage of working in a home health setting is paperwork. So but after the start of care, it will be a regular therapy visit note. It's no longer as toxic as the start of care. The start of care is really the most ridiculous paperwork that you have to do in a home health setting. So after you see the patient, you have some paperwork to do at home. Okay, that's one major disadvantage of that. Another disadvantage, and for some this might not be disadvantage, but driving. It's a lot of driving from one place to another. It is not like working in an outpatient facility or a skilled nursing facility. You drive to one place, the patients will be there. In a home health setting, just like what it says, home health, so you drive to their home. So that's why it requires a lot of planning in your calendar, so that you are not bouncing back and forth. Okay, so you have to know your location, you have to know the zip codes, you have to know which area is next to each other, so you can diligently schedule your patient close together, those patients who live together, so that you can save some mileage, some gas. Okay, another disadvantage is cancellation. Something will come up, the patient is sick, the patient forgot that they have a doctor's appointment, the patient is not answering the call, so you have cancellation, and with cancellation, no pay. Okay, so you made all this schedule for the whole week, and this day the patient canceled or another patient canceled. So that is the disadvantage of that, the cancellation, because of unforeseen circumstances or events. Okay, so of course, no visit, no pay. Okay, another one is some dirty houses. Okay, so that is why there is like a bag technique in which you use barrier like a paper, or some companies give you their own barrier, plastic, that you put your stuff, that barrier on the table or whatever surface you're gonna put your home health bag and other things on top of it, so it's not accumulating the dirt from the house. Okay, so some houses unfortunately are not clean, and of course another thing is in unsafe location. Okay, so sometimes it's very important for you, before you take the assignment, before you say yes, I'm going to take this patient, if you have that freedom to do so, is to check if the location is safe. Okay, but you can always voice out to your supervisor, to the company that you work for, that hey, I do not feel safe going to this location, and you say your concern, and they should be able to listen to you based on your report. Okay, so just a recap for our advantages and disadvantages. So working in a home health, you have the flexibility, you can make your own schedule, you have the autonomy to make decisions what's best for the patient, one-on-one setting in which you're treating patient just one-on-one, no overlap. You help the patient to be as independent as they can be, as safe as they can be in their own home. And compared to other setting, it pays decent amount or higher paying setting. And then the disadvantages are paperwork, driving, unless you like driving. So driving can be a disadvantage. Cancellation, no visit, no pay, some dirty houses, and unsafe location. So I hope that this gives you some idea on how it is to work in a home health setting. Just like what they say, you'll never know until you personally experience it. Okay, if you are a young therapist, I would suggest that you venture in different setting before really settling into what you really want to do for the rest of your career. Okay, because you cannot just base your decision based on what you hear from other people's experience, because their experience is unique to them. Okay, So if you want to venture in different settings, that will be enrichment for your personal experience as a therapist. Okay, thank you so much for watching and bearing with me. I hope this video is helpful to you. Please share this video to your colleagues, to your friends, or other people who you know that may benefit from this video and other videos of Just Upright. Thank you so much and stay blessed. Thank you so much for watching. Please do not forget to hit the subscribe button below to be updated with the latest video releases. Share this channel to other people you know who will benefit from Just Upright videos. Thank you again and stay blessed.